People with jobs that require standing for long periods of time have a higher risk of developing varicose veins. But so are jobs that entail sitting all day. That's because both situations put excessive pressure on your legs, causing your veins to stop working properly and even swell, resulting in those bulging blue or purple veins on your legs. Now, most of the time, these are simply a cosmetic concern, but for others, they can cause aching pain and discomfort, and maybe other serious complications later on. While there is no way to completely prevent it, self-care can ease the pain and prevent it from getting worse. I'm Dr. Freddy Gomez, and you're watching the Doc Health Talk on CNN Philippines. We're here to build a healthier future for you. Varicose veins occur when your veins become enlarged, dilated, and overfilled with blood, and they typically appear swollen and raised. To help us with today's discussion, let's welcome our guests. With us is Dr. Angela Pineda. She's a dermatologist and the Executive Vice President of Derm Clinic. Also with us is Dr. Riza Cruz Nagano. She's an adult cardiologist from the Philippine Heart Center and Jose Memorial Medical Center. Now, the primary symptoms of varicose veins are highly visible, misshapen veins that usually appear on someone's legs. I'll start the discussion with Dr. Angela. Now, apart from some of the visible symptoms, what are some other indications that someone might have them?
Well, for us, what we really see are the spider veins. So just the difference between the spider veins and the varicose veins are the spider veins are smaller. These are like very, very small, less than 1.5 millimeters. But those for varicose veins, these are the bigger ones that usually they're 2.5 to 5 millimeters. So what happens when patients come to us, they complain of redness or a visibility of lines on the face or usually most common on the legs.
Now, spider veins, katulad sinabi ni Dr. Angela, are a mild variation of varicose veins. They're smaller, found closer to the skin surface, and are often red or blue. And they usually appear on the legs, sometimes on the soles of the feet as well, but they can also be found on the face. Now, Dr. Angela, yung mga spider veins ba na ito, do they pose any significant problems with a person aside from the aesthetic portion of it?
Usually, for those in the legs, they usually appear with varicose veins. So sometimes people would come to us complaining of both the varicose and the spider veins. So we always remind them that we can limit our treatments to the spider veins. We can do superficial treatments for that. But we also recommend that they consult a doctor and have additional tests to make sure that the varicose veins are also treated.
Now, I'll talk about how these varicose veins are diagnosed. Dr. Riza, paano ba usually ina-assess ang isang patient for proper diagnosis of varicose veins?
So very important still is the proper history and physical examination. So during the physical examination, we get the what you call the ankle brachial index. So we get the pressures from the different points of the legs. And then also we get to examine the legs if there are signs of ulcers, ulcerations, the temperature of the skin. So if it is warm to touch, cold to touch, we also check for the pulses. And then another examination that can be done is the ultrasound or the arterial duplex scan.
Now, Dr. Riza, meron bang test, simple test na pwede gawin ng ating mga viewers sa bahay nila to more or less screen themselves kung baka meron silang mga varicose veins sa legs?
Yes, simple inspection will do because as you can see, these are enlarged vein, very visible through the skin, so they can inspect and then they can touch the involved area, and then they can, like I have said earlier, they can inspect if the area is warm to touch, cold to touch, and then they can check the pulse. if there's a palpable pulse or there's no palpable pulse in the area.
Now, when it comes to risk factors, Dr. Angela, what are some of the risk factors for people developing spider veins or even larger varicose veins?
For risk factors, the first is the family history. Usually, you'd see it's either their parents or their relatives already have it very common. Next would be obesity as well as pregnancy. Sometimes the veins appear more visible when there's pag-pregnant yung babae.
Now, Dr. Riza, when it comes to being pregnant, bakit ito isang risk factor for developing varicose veins?
During pregnancy, the blood volume doubles to provide nourishment for the baby as well as the baby inside the womb. So what happens if there's increased blood volume, it stresses the veins. So there's increased pressure inside and more blood pools inside the vein. And also the pressure brought about by the weight of the baby also adds up to the workload of the vein. So causing more engorgement, more enlargement, and more obvious varicose vein.
Now, Dr. Riza, ano yung mga trabaho na mas nakakapagpataas ang chance na magkaroon ng varicose veins?
The major risk factor related with jobs that increases the chance of having varicose veins is the lack of movement. So those jobs that entails you to stand for a long period of time or sit for a long period of time would increase the risk. So mainly these are the healthcare professionals like us, doctors, nurses, and cashiers, barbers, hairstylists, and those who sit for a long period of time, like the BPO agents, and those who require to work in front of the computer for a long period of time.
Now, most of the time, this condition doesn't cause any pain, so you tend to just let it be. But what are the possible complications? More on this when we return. Were you connected to healthcare? You're watching MedTalk Health Talk. Although somewhat common, varicose veins can cause complications. Now, any condition in which proper blood flow is undermined has a risk of complications. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk. We're together in health. Painful ulcers may form on the skin near varicose veins, particularly around the ankles, and this is called a venous skin ulcer. It's a sore in the leg that's very slow to heal, usually because of weak blood circulation in the limb, and can often be accompanied by other comorbid conditions. Dr. Riza, how can varicose veins cause an ulcer?
So usually the main problem with varicose veins is the pooling of blood, increasing the pressure inside the vein, causing the walls of the vein to weaken as well as the valve to weaken. So also the blood supply of the skin becomes disrupted. So the skin becomes fragile. So even a minor injury like a scratch or a knock would cause an ulcer. And this ulcer doesn't heal up easily because of the problem in the circulation.
Now, Dr. Angela, speaking of the skin, since we're in that area, if there are any wounds of our viewers that do not heal properly or are very slow to heal, what should they think about? What are some of the conditions that they should be thinking about?
Usually for patients with diabetes, you usually see ulcers that are not healing. Also for patients who are not ambulatory or usually bedridden, you'd see the accumulation of ulcers. So as said by Dr. Riza, it's mainly because there's minimal blood flow to that area. So that's why you'd see more visible ulcers.
Now, Dr. Angela, when it comes to varicose veins, one of the more common symptoms of this is masakit ito, so very painful. Are there any topical treatments that are worthy of being used to help with this, or should this be approached in a systemic way?
It should be approached in a systemic way because you'd see the problem superficially, but meron kasi siyang internal concern. So it's more, and usually the pain is associated with throbbing pain, and sometimes there is a feeling of heaviness in the area. So it's something that should really be examined.
So if you have a wound that isn't healing or you think is infected, you should go see a doctor right away. Sometimes an ulcer can lead to other problems, including serious skin and bone infections. Now, most varicose veins are in the superficial veins. So if a blood clot forms, they form there. Now, these veins are located just below the surface of your skin. But occasionally, veins deep within the legs become enlarged and the affected leg may become painful. This may also indicate the presence of a blood clot. Now, Dr. Riza, how do blood clots form, or is there an increased risk of blood clot formation doon sa mga may varicose veins?
Definitely. Since there's pooling of the blood, so there's stasis, the blood doesn't flow in and out of the vein. So it becomes a nidus for the formation of the clot. And this clot can also travel to other area of the body, which can cause embolism or problem to other organs, as it may impede the oxygen supply once it becomes clotted in that area.
So would you advise, Dr. Riza, na those who have varicose veins or who think they have varicose veins, now this is something that should be treated sooner rather than later?
Yes, because this is a circulatory problem. So if you do not manage it, there will only be a cycle of increasing pressure, blood pooling, enlargement of the veins. So something really has to be done to manage those underlying problems.
Okay. Now, Dr. Angela, what treatment options are there? Also with the telangiectatic type or the mga maninipis na ugat dito sa may cheeks ng ibang tao, are there treatments available for those?
So one traditional and common treatment that's being used is sclerotherapy. So it's using a salt solution enriched that is injected to the spider veins. And then one that's very popular now, it's the laser treatments. So these laser treatments, usually what's done is there's a specific wavelength that's adjusted to machines or to the recent technology that when you apply it, it would take some sessions to be able to minimize or somehow dissolve those spider veins.
Now, Dr. Riza, pag-usapan naman natin yung treatment para doon sa mga mas malalaking varicose veins, especially the ones commonly seen around the leg. Anong usual treatment para dito?
So for those who have large varicose veins and those that doesn't respond to other methods like sclerotherapy or radiofrequency ablation, so another option that we have is the surgical intervention or the vein ligation and stripping.
So, ang importante malaman na ating mga viewers that there are treatment options for any type of varicose veins that you may have, whether it be the spider veins or the bigger varicose veins. Now, varicose veins develop for various reasons, and some of these risk factors, such as family history as well as age, are harder to avoid than others. So, is there a way to prevent varicose veins from forming? Stay with us. Your health is our mission. This is MedTalk Health Talk. Varicose veins can't be completely prevented. However, you can prevent existing varicose veins from worsening. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk, where your care always comes first. You can make lifestyle changes that may keep varicose veins from getting worse and even reduce the pain. One thing you can do is to exercise. This helps the blood move through your veins better. Dr. Angela, aside from these, what else can people do in order to try and prevent their spider veins, for that matter, becoming worse?
So for one basic way is to make movements more frequent. Like for example, we already mentioned that it happens when you're prolonged standing. So we recommend, even for teachers or for those professions who are standing the whole day, we recommend that they just move around and they just make subtle changes. And for those who are working, especially now that work from home is very, very common, so we're always sitting. So we recommend after maybe 30 minutes or so, you change position, adjust your legs. So these are basic treatments that we can do every day so that it would prevent the occurrence of varicose veins.
Our viewers now are working behind the desk for longer periods of time. What can you advise for them? How often should they start moving para hindi tumaas ang risk for forming varicose veins?
Yes, movement is very important. So, as long as they have the chance to move and elevate their legs, I think it is most important is to elevate the legs higher than the rest of the body because this will decrease the pressure inside the vein and would help the blood to move in and out of the vein. So whenever they have the chance, try to move and elevate the legs.
Now, Dr. Riza, one of the common things that our viewers might be familiar about when it comes to varicose veins is yung pagsuot ng compression stockings. How exactly does this help with varicose veins? At pareho ba ito ng ibang klaseng mga stockings na sinusuot every day?
So compression stockings help counter the pressure inside the vein, helping the circulation of the blood in and out of the vein. So this can ease the symptoms of leg fullness and the aches associated with varicose veins. So this is different from the usual stockings that we use because there's a certain amount of pressure that is recommended depending on the severity of the varicose veins or if there is leg ulcer. And also it is very important to consult your doctor before using compression stockings because there are some conditions in the legs, some circulatory conditions where compression stocking is not recommended. So instead of doing you good, it might further aggravate your condition.
Now, Dr. Angelo, when it comes to treatment for cosmetic purposes ng veins, a lot of people might think that there are some home remedies for this. Is this something safe to undergo, home remedies to treat spider veins, or is it best that people always seek the consult of a doctor?
But I think we can do prevention techniques rather than self-medicate because these things that we're saying, it's more to be able to prevent it from appearing. But if, for example, you already have spider veins, you already have varicose veins, or even leg ulcers, it's best to have consultations, even online, so that at least the doctor will be able to properly assess your condition and give the right recommendations.
Now, Dr. Riza, when it comes to preventing varicosities as well, what can you advise our viewers?
It is very important to maintain a healthy weight because obesity is a major risk factor for developing varicose veins. Also, you should prevent or quit with cigarette smoking, which is also a very important risk factor for developing varicose veins as well as other circulatory problems.
So marami talaga tayong natutunan with this episode today. Thank you very much, dermatologist Dr. Angela Pineda and cardiologist Dr. Riza Cruz Naganyo. Marami pong salamat sa inyo. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk.
Loren Legarda po. 18 years akong senador at nagsulong ng mga batas na nakakatulong sa mga nangangailangan. Free college education law.
Para sa aming edukasyon.
MSME law.
Batas para sa aming kabuhayan.
Climate Change Act.
Mga batas para sa kalikasan at climate change.
Mga batas na ginawa ko na napapakinabangan ngayon. Sana makatulong pa ako sa mas marami.